WEBCAST is now starting. All attendees are in listen-only mode.
Hi, good afternoon, everyone. Today is Wednesday, September 30th. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the Maryland Community of Practice for Supporting Families webinar series. This is webinar number 10, Electronic Visit Verification, EVV. This session is being facilitated by Kane-Breschi, Director of Family Supports for DVA. Our guests today are Joseph Walburn from the Maryland Department of Health in the In-Home Supports Assurance System, ISAS division, and also Kathy Naviasky, the Chief Operating Officer with Abilities Network. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There's two options for listening. That's by computer and smartphone. And there is a handout. There's actually going to be 5 handouts in the webinar section, in the handout section on the panel to your right. We're recording the webinar, and at the end, we'll take questions directly related to the webinar. So if you have a question regarding services and supports, please contact your local regional office. If you have questions related to Appendix K, please submit them to dda.toolkitinfo@maryland.gov. In addition, we're interested in highlighting how people with disabilities and their families are supporting and caring for one another during this pandemic throughout the webinar series. If you're interested in sharing your story, please contact Kane-Breschi directly at mary.kane-breschi@maryland.gov or me, donna.will@maryland.gov. So now I'd like to introduce Kane-Breschi. Good afternoon.
Thank you, Donna. Good afternoon, everyone. And on behalf of the Maryland Community of Practice for Supporting Families, welcome to our webinar titled Electronic Visit Verification. The purpose of this series for supporting families is to bring people with intellectual and developmental disabilities and their families, however defined, along with others together in order to connect, to share important information and ideas, all in an effort to support one another and build resiliency within ourselves and the community as we find our way through this pandemic and beyond. Throughout this series, we are discussing a variety of topics impacting individuals and families related to COVID-19 and everyday life. We do this through the lens of charting the life course framework and with the help of invited guests and subject matter experts. Today, we have 2 amazing guests to assist us. But before I introduce them, I'd like to talk a bit about charting the life course framework. Many of you are already familiar with charting the life course, but for those of you who aren't, it is a set of universal principles and tools. Its fundamental principle states that all people have the right to live, love, learn, work, and play, and pursue their aspirations in the community. Charting the Life course was developed out of the University of Missouri, Kansas City Institute for Human Development and Family-to-Family program by families and people with DD to help other people and families develop and create a vision for a good life. Also to think about what they need to know and do, navigate and develop supports and resources, and finally to really understand and discover what it's going to take to live their lives of their choosing and to be able to do it. But not only can we apply the principles, can individuals and families apply these principles to their lives, these principles can be applied within agencies and organizations and systems and so forth. And in fact, these principles inform the work of the Maryland Community of Practice for Supporting Families, as well as that of the Developmental Disability Administration, as we work to create regulations, policies, and practices to better support people with DD and their families across their lifespan. Today, I'd like to highlight individual and family supports. As a principle, Charting the Life course recognizes that people with developmental disabilities and their families need and utilize a myriad of supports, resources, and services in order to build their lives. And as they live their lives, we know that people and families grow and change, as do their needs. Therefore, as a system, we need and want to provide supports that address all facets of life. and adjust as the roles and the needs of all family members change. The types of supports, this includes support such as discovery and navigation. Think of information, education, and skill building, connecting and networking, which includes peer support. Think of family to family, and goods and services. Think about personal supports received through DDA, other waiver services and supports, education services and support, so forth and so on. So today, our goal is to provide you with the information and the skills you'll need to utilize the EVV system, making ultimately personal supports possible, right? They need to be paid for. And so fortunately, we have two wonderful guests who are going to help us do that. So with that, I'd like to please welcome Joseph Walburn. Joseph is a business analytics computer supervisor in the in-home supports assurance division at the Maryland Department of Health, and Kathy Naviasky, who is with Abilities Network. She is their chief operating officer. And with that, we're going to start with Joey. And Joey, let's take it away, and I will be controlling the slides. So just let me know when you want me to move them. Thank you and welcome.
Sure, thank you. Yeah, can you hear me okay?
Yes.
Great. So again, my name is Joey Walburn. I work with the in-home supports assurance system team. So today I'm going to give everybody a kind of high-level walkthrough of ISAS and electronic visit verification and what that means. So if you go ahead, you can advance, please. So for the introduction, to start us off, I'm going to talk about what is EVV. So electronic visit verification, or EVV, refers to the technology that electronically verifies that services are delivered to the right participant at the right time and at the right place. This is required for both provider and self-directed services. So the system that we use here in Maryland for electronic visit verification is, again, the in-home supports assurance system. And this is a phone-based electronic billing system that personal supports providers use. So DSPs, or direct support professionals, will check in at the start and end of every service that they provide. And they'll do that using either the person's telephone who's receiving services, or a one-time passcode device that is assigned to them. And we'll talk a little bit more about that later. So the reason we're implementing EVV is the 21st Century Cures Act, which is a federal law, requires that Maryland uses EVV to verify 6 factors for personal supports. And that is the type of service that's performed, the person who's receiving the services, the date of the service, the location of the service, the person who's providing the service, and the time that the service begins and ends. And so the federal government did have a deadline for implementing this. So the deadline we are running up against is January 2021. And so that's why over the next few months, we're going to be working on implementing EVV for the state. You can advance, please. So the benefits of EVV for the individual receiving services, the goal and the benefit is to help ensure that the correct services are being provided in the correct amounts. It can help us improve the quality of services being delivered. It helps make sure that the DSP's activities are transparent. It gives us more data to work with, so it's measurable. And for the DDA, it records when the DSP starts and stops working, which reduces the likelihood of billing errors and fraud. It helps us hold providers accountable to deliver the services they agreed to. And it allows us, again, to comply with the federal regulations, the 21st Century Cures Act. And for providers, the system is beneficial because it helps simplify the billing process. It helps make reporting a little bit more efficient because everything is automated. and it enables providers to go online to review service information. It gives us a HIPAA compliant and secure system with encryption to record and store data. And it makes sure that service delivery data is readily available and accessible. And then it records when the DSPs start and stop working, which I mentioned before, helps reduce the likelihood of errors and fraud occurring. You can advance. So very briefly, we just wanted to touch on self-direction. Personal supports providers who work with self-directing participants will not be using the ISAS system for electronic visit verification. So the fiscal intermediary that will be providing self-direction will supply its own EVV system to support these providers. And so we're still working on identifying the exact specifications of how that system will work and what it will look like. But the DDA should be providing further guidance in the future as more information is learned. So here we wanted to start talking a little bit about how EVV has been implemented. So again, the in-home supports assurance system is the system that we use for EVV now. It's phone-based and it's an electronic billing system. And so all traditional service providers who provide personal supports are required to use ISAS to clock in and out for each of their shifts. And so the way that it works is the DSP will call the ISAS toll-free number. ISAS will verify who that provider is. That'll be done either based on both the provider's agency Medicaid number and also the DSP's Social Security number. ISAS will then verify who the person receiving services is, and that's done in one of two ways, either by the person's telephone number, which is registered in our LCSS Maryland system, or it can be determined based on an OTP device that we issue. And an important note for the telephone numbers, it can be a cell phone number, it can also be a landline. What's most important is that it belongs to the participant receiving services. And then finally, ISAS will verify the service being delivered based on the person-centered plan. The system does check what the PCP contains and it identifies the correct service. We continue. So talking a little bit more about how the person receiving services is verified. So DSPs will use a landline or a cell phone that belongs to the recipient, the participant receiving services. And so this phone number is approved and it's listed in the participant profile in LTSS. And so that's something that the participant's CCS coordinator can help register. And again, this phone must belong to the participant. In cases where a phone is not available to be used, we do issue what we call an OTP device, a one-time password device. So using that device, DSPs can call from any phone number available. It does not have to be listed in our system, but they will be required to either enter the participant's 11-digit MA number or the serial code from the back of the OTP device. Thank you. So here we have some more details on an OTP device, including a picture of what the device looks like. So the way the OTP device works, and you can see this in the picture a little bit, is it's a small keychain sized device, and it generates a 6-digit timestamp, which is shown there. So the DSP will use this device when they clock in and out, and then on the back of it, they can use the 9-digit OTP serial number if no MA number is available. So generally, we will assign OTP devices in a few instances. So the first one is if the participant does not have a reliable phone that the DSP can use. If there is more than one person receiving personal supports who live in the same household and they share a phone. If the person is often receiving services in the community, and they have a landline at home that can be used, but they're not getting services at home very often, or if the participant does not have an MA number, and that should mostly apply to participants in the state-funded program. And so the way the assignment process for OTP devices works is our team here at MDH on the ISAS team, we will register the OTP device in our system. The OTP devices will be distributed in large batches to the coordinators of community services, to each of their agencies as needed. And then the CCS agencies will maintain those batches of OTP devices. And when they'll work with the participant and their family to identify when an OTP is needed, and they'll be responsible for assigning those devices. Once they're assigned in our system to an individual, they'll work with the family to coordinate a time to distribute those devices or do that by mail. And then if there are lost or broken devices, or if it's no longer needed, those should be returned to the CCS agency and they can unassign it and give it to somebody else. Or if it's broken, they can just return it to MDH for our inventory. Some important notes, the OTP tokens should stay with the participant at all times. It's important that they keep it in their possession. And then just make it available at the start and end of each service to the DSP. And then return and delivery of devices should be coordinated directly between the CCS and the participant. And so here we'll talk a little bit about the roles of all the different actors in this process. So the first, the role of the family. Families play an important role in all of this. They will coordinate with the CCS to assign a phone number for use with the ISAS system. They'll also help make the OTP devices available for the DSPs in the home or in the community if services are provided there. They'll be responsible for reporting any missing or broken OTP devices to the CCS so that they can be replaced. And they can work with the CCS to address any service issues that may arise. And so on the CCS side, their staff can help by managing the available phone numbers for use in the LCSS Maryland system, managing OTP assignment and delivery. They can help ensure the PCP has the correct hours for providers to bill using ISAS. And then they can help families address any service issues that come up. And so on our team, within the ISAS team, our role is to really be your point of contact if there are policy questions, billing or payment issues, or just general system process questions. We have a team here at the department that can help with that. And our contact information is listed on this slide, phone or email. And then at the agency, the administrators play an important role in managing the different DSP staff and their profiles in the tracking system, ensuring that the DSPs are trained to provide services and use the system to record those services. They're responsible for reviewing and ensuring that the services are accurate and they're recorded accurately, and then assisting with resolving any issues with those services to make sure that the payment goes through correctly. And so the DSPs providing the service, of course, responsible for providing direct supports. They, again, must use ISAS to clock in and out. And then if there are any issues with clocking in or if they forgot, then they should report those to their agency administrators so they can help correct them. And so here, if you have any further questions, we've identified some contacts. So our contact information for the ISAS team is listed here again. If you have questions about EVV, you can reach out. And then if there are general questions about DDA services or policy, you can contact your local regional office. And so here on this slide, here are the
Abilities Network.
Thank you. So Abilities Network is a statewide organization. We're made up of 4 programs. The Community Employment Partners Program is the one that is funded by DDA. Our mission is to challenge the community to acknowledge the value and equality of people of all abilities. And I think our tagline of seeing abilities, not disabilities, really does kind of say it all as to the services we provide and our approach to all services.
It sure does. It does. Can you tell me or tell us, who do you serve and what are the services that you provide?
So I mentioned we're a statewide organization, and we serve mostly adults, a few children here and there, but mostly adults, and we provide employment services, personal support services, and community development services. Our services are all designed with each individual's goals in mind, and in today's COVID world, we've kind of had to pivot a little bit. We continue to support folks who are essential workers and provide essential services to folks, but we've also created some virtual support that include cooking classes, we have some game shows, we have a virtual drum circle. And then for folks who are still looking for employment, we continue to provide support in finding jobs and maintaining and making sure you're successful in all of those jobs.
Wonderful. Can you, so today we're here talking about EVV. Abilities Network participated in the pilot. Can you tell us about the experience as an agency? What has that been for you?
Sure. It's actually given us a great opportunity to work hand in hand with DDA to launch this new system. One of the things that we made sure that families in the pilot understood was that our services really didn't change. It was more of a system change as opposed to a service change. So we're using EVV with just a handful of folks. It's given us a nice opportunity to learn some tricks, kind of be on the front lines of that and be able to provide that information to folks who are getting ready to start using it as well. And also to help our staff understand the importance of the key fob and calling in. And it helped us to provide some supports to our staff to learn how to use it as well.
So overall, how's it going, and when will you roll out EVV formally?
So as with anything new, there's going to be a few bumps in the road, and there were a few bumps, but that's okay. Nothing that really couldn't be worked out. Because we're a statewide organization, we are going to be rolling out EVV formally on December 1 with the Central Region.
Okay, great. Well, you mentioned previously about lessons learned during the pilot. So I'd like to ask you a couple of questions, if you don't mind, that you actually indicated were questions that often came up. So I'm going to begin with the first one. And this is about whether or not the direct support professional will need to use the person's phone.
So you have to use the person, our staff will use the person's phone if you've logged in your cell phone number or your home number into the LCSS system and told your CCS that that's the method in which you want to use. So at that point, our staff will go in and they will use your phone number to call into that number and document that they're starting services. If you've chosen to use the key fob option, the staff will not need to use your personal phone or your landline. For our agency, all of our staff have been given an agency phone, and they will use that phone to call in using the key fob serial number as well as the 6 digits on the front of the key fob.
Okay. Well, here's a picture of the key fob. Where should the person or the family keep the key fob?
So it's really important to make sure that you talk with your team about where you're going to keep the key fob so that staff can, the DSPs can remind you where it may be. A couple of the folks that we work with, one has chosen a bowl on his table and he puts it there every time he comes back in so that everybody knows where it is. Another individual has chosen to connect it to her wallet because as she goes out with staff, she always has it on her wallet. As an agency, we've actually chosen to provide lanyards to all of the folks who are in personal supports and have a key fob. And we're going to work with them on keeping that lanyard somewhere safe. Again, it is, we're going to use a red lanyard so it kind of jumps out at you if you put it in the drawer. And our staff will always remind you to make sure you have it with you before they start services.
Great, great. Well, let me ask you this. If a person has only one staff, can that staff keep the key fob for them?
No, the key fob needs to stay with the individual receiving the services. And we've made that very clear to our staff and our teams, that key fob is to be with the individual, not in our possession at any time.
Well, okay, so what happens if the person forgets their key fob when they meet their staff out in the community?
So things happen, no worries is what we've told everybody. Each agency is putting their own internal system in place as to what to tell their staff to do if that does happen. I know that we have a system in place where we ask our staff if the person doesn't have their key fob with them to text a number and provide us with the information on who you're working with and the time that you started services.
Great, great. And then finally, what does the person do if they lose the fob? Can they still get the service?
Yes. Again, that's one of those things happen. If you lose your fob, you can talk to your direct support staff, and they can help you connect with your CCS who can replace that key fob for you, but services we can continue to provide services. And again, each agency will have its own internal system into how to notify somebody at your office that you were providing that service, but the key fob was not available.
Terrific. Okay. Well, Kathy, thank you. This is incredibly useful information and appreciate you taking the time to share it with us. What I'd like to do now is I'd like to talk about resources that DDA, so eligibility specific resources that DDA has developed and does provide to the persons in service, families, agencies, and staff. You'll need to go to our DDA's homepage, and once there, you'll see the yellow arrow indicates, you'll see the electronic visit verification link. You click on that, and that'll take you to the EVV webpage. And here you'll find a list of all of the resources, all of the documents, tips, FAQs pertaining to EVV. There are memos, there's information for participants and families, CCSs, direct support professionals, provider leadership, so forth and so on. And we've also included a list of the webinars that have been done pertaining to EVV. So you really have a plethora of information here, and we hope you'll avail yourself of it. Also, for those of you who are interested and aren't already receiving our newsletter, we'd like to remind you that you can, and we welcome and hope that you do. And if you go to our homepage, and again, the yellow arrow indicates join our mailing list. And if you'll click on that and sign up, you'll receive the newsletter. And our newsletter provides you with the most updated information. Our most recent one spoke specifically to EVV. And so we hope you'll do that. Now, to wrap up, I'd like to bring the webinar to a close, but before we do that, we'd like to take questions. Again, we are hoping to receive questions specifically related to the webinar. If you have other questions regarding services and supports, you can certainly contact your local regional offices. You can also reach out to your CCSs, and if you have questions related to Appendix K, please submit them to the DDA Toolkit info@maryland.gov. With that, Erin, who has been monitoring the questions, is going to ask the questions if we have them. Erin?
Hi, everyone. There are a number of great questions in the chat, and so we'll work through as many of those as we can. The first question that's coming up a lot, particularly given where we are with COVID-19, is that there are a number of people getting virtual visits or remote support, and folks want to know how will that work and what's the role of the token in all of this. So maybe Kathy, do you want to talk about that?
Sure. So obviously in remote supports, we're not using the token. LTSS has a system in place where we can submit that authorized service manually, and we have a COVID remote services verbiage that we add to it so that it does get in the billing process, but it does not need to be done through the key fob.
Thank you. Patricia or Joey, anything you'd want to add to that?
I don't have anything to add. I think she did a good job covering it.
Yeah,
so
I
we see
agree.
that,
Thank you.
we see that come in our
All
team
right.
to account.
Yeah. So the next question has to do with people wondering whether you can use either a phone and an OTP token at the same time, like have both of them in play, or whether you can switch. Joey, do you want to address that?
For people who, this may apply actually to people who maybe receive services in the community a lot, as an example. And so maybe they have an OTP device assigned because they're often away from home, not able to use the landline. For those types of people, the system is set up so that if they do one day, say the provider meets them in their home and they use the landline, it's set up to skip the OTP step. So they would not need to enter that in. And it would recognize who the person receiving services is based on the phone number that's registered to them.
Erin, are there any more questions?
Oh, I'm being muted. Yeah, sorry.
That's okay.
There's a couple of questions around this idea that the token should stay with the person. So first is, just to clarify, is the token assigned to the person or to the direct support professional?
The
Kathy,
token,
do you want to? Go ahead, Joey.
Sorry.
You're good. No, you're good.
It's assigned to the person, not to the direct support professional. And we do ask that the direct support professional does not take it away from the participant.
Okay, and then there's a follow-up, and it says, what stops staff from copying the number on the OTP token and keeping it with them to call from anywhere? Joey, if you want to talk more about how the device works.
So the number, the code on the front of the device is synchronized with a specific time of day. And so that code will always register with that time of day whenever it's used. And so that shouldn't be a problem. We ask that DSPs do not do that. And we've been working with the agencies to communicate that.
Okay. And then another question about how the tokens work. Do they work both in your house and in the community? So if somebody's getting personal supports in the community and the direct support professional switch out there, the person ends their services, can the staff clock out in the community? Joey, if you want to just keep with this.
Sure. Yep. Didn't want to jump ahead again. But yes, the OTP devices do work in the home and in the community. So I think I mentioned before that sometimes people who do not have phones at home that work, or maybe they have poor service because of the area they're in, then the OTP devices can act as a substitute within the home. And then if they go out in the community to end the service, then they can take that OTP device with them and still use it out in the community.
Great. Patricia, there are some questions that are asking about whether electronic visit verification will apply to community development services, to day habilitation, to residential services. Do you want to clarify that?
Sure, that's a great question. So any of the electronic visit verifications only applies to people who are in personal support services. So people are asking a lot of that question throughout this, and there's also some other questions about self-direction. So I just wanted to be very clear that the only time that we're using the EVV is for people who are getting personal support services. That's it.
Great, thank you. Kathy, one of the questions is, can staff use their own phone? Do they have to use the personal phone? Can you talk about that?
Sure. Staff can use their own phone if the individual is using the key fob. If the individual is using their if the individual has decided not to have a key fob and wants to register their cell phone or landline with the system, then they would have to use their own phone for that.
Thank you. So people have noted, and you guys are so right, so thank you for asking this question, that we've talked about an OTP, a device, and a token. Are they the same thing? And they are. An OTP, right, is one-time password. Those are those numbers that come up that Joey talked about. They change every 10 seconds, which is why people can't copy them down and take them with them. And that is all the same device. It looks like somebody else wrote in, you also called it a fob. We did. So thank you for that. That's really helpful. We'll try and be better about that, but I'm really glad you asked those questions. Let's see. So there are questions about how are we helping people learn about how to use the key fob and the phone. I think, you know, this webinar is one of those things. Patricia, if you want to talk about some other ways that we're working to help inform people.
Sure, thank you, Erin. So outside of this webinar, we are going to be conducting lots of communication with families and participants. We're also working with the case managers to be able to provide additional information to the participants who are using this system. So please make sure you follow us through our website. And make sure, as Marianne shared with you, make sure that you are registered to as a constant contact so that you can get all of our information, because we are constantly on a weekly or daily basis adding information that I think we're portraying to you guys. And we are focusing right now on EVV. We have some great handouts that you have in this presentation today. There's one that we were not able to upload right now, but we will. And it's really a picture specific to families and participants that really helps you walk through about the system and the OTP and the device, and what to do if you lose it, what to do if somehow you misplace it, where do you go and get one. So we're hoping to do some frequently asked questions, not only for families and people, but also our providers. So those are the kind of educational things that we'll be doing, Erin. And I know that we also have Shioma's team, who's in the lead of our LCSS Maryland, providing right now a specific training to our stakeholders on how to use the system and how do we transition to this EVV and personal supports.
Great, thank you. Patricia, there's a couple of questions coming in from family members who want to know if they're working as the person staff, do they have to do EVV for personal support?
I'm sorry, say that again.
So if a person's mom or dad or sibling or, you know, somebody who's in their family is working as their direct support professional and providing personal support, does their family member have to participate in electronic visit verification? Are they expected to sign in and out of their time?
Anybody that is hired to do a personal support service must do the EVV. So if you are in personal supports and you hire a family member, or you're a family member providing that service, you have to use the EVV system. You are the person who has been hired to provide that service. Joey, do you want to add anything to that?
No, I think that about covers it. Yeah, nothing to add.
Great. And Patricia, if we can stick with you for a minute, folks are asking about the deadlines across Maryland for EVV implementation. When is this all going live?
That is a great question. We actually put some information on the website as to who's going live and when. And we started with our Eastern Shore and Western, and we're looking at when we roll those dates out. And then we also looked at when we're going to do Central and Southern. So I have to go look over the website, but we're looking at having tomorrow is our first day where we're looking at Eastern and Western. And then we're looking at November for the other two regions.
Thank you.
But all
So
of this
there are two
for us, Erin, for all of this is right now, our full implementation day has to be done by January 1st. So this is getting everybody up rolling, getting everybody in order, making sure everybody has the devices, making sure everybody understands how to use this, so that when we have to go live, or when we have to implement this fully, it would be all ready to go.
Thank you. So there are two questions that several people that we, I guess, answered, but there are still a number of questions about. And so I want to go back to them because they're pretty important for folks who will be beginning to use this. One of them is, how does it work if you have your phone signed up and you have your OTP device signed up? Sort of, you know, if somebody calls in your landline, do they still have to use your OTP device? So maybe, Kathy, you talked through it last time, Joey or Patricia, one of you want to work through how the two alternatives can work together pretty concretely. I think that would help.
Sure, I can talk about it. So the OTP device, I think in the example I gave before, so if a person is, say they receive services in the community pretty often, but occasionally they will be at home, then an OTP device can be assigned for use in the community. But when they are at home, maybe they also have a landline telephone that's been assigned and is being tracked in our LCSS system. And in that case, if the DSP uses that landline telephone, the system should be configured to bypass that OTP step. And so the telephone number is used to verify who that participant receiving services is.
Okay, that's helpful. And what I'm thinking is we can certainly do frequently asked questions following this webinar. There have been so many good questions, and I know other families will have the same ones. And we'll make sure to include this question as part of that. The other question that came up a couple times after we talked about it still was, how does it work for remote support? When people, the staff providing the support are not with the person and don't have access to the person's assigned phone number or the token. How do they clock in and clock out? Maybe Kathy, do you want to talk about that?
Sure. So through remote services, there won't be any clock in or clock out. The information will get to LTSS from a manual input at your agency's billing office or whatever your agency system has in place. So again, you will have to work as an agency to create an internal structure, an internal process in which to make sure that that information is gathered. For us, we have a database where every time we work with somebody, we document the goals that we worked on, and we pull that information out of that database to put that information into LTSS. So again, it's an internal process within your agency to get that information for remote services into LTSS. I hope that answered the question.
Yeah, I think
Hey,
so.
Erin.
So really,
Erin.
Yep.
Erin, I just wanted to just make sure, because I know they're asking a lot of these questions, and I'm going to speak really slow about the EVV implementation for DDA. And so for the EVV implementation by the regions, for October 1st, which is tomorrow, is Eastern Shore and Western Maryland. So we're working with those teams right now, and the CCSs and the providers in the regions right now with them. Southern Maryland, we're looking at November 1st. And then we're looking at Central Maryland, December 1st. And then everything to be ready to be fully implemented by January 1st. So again, Eastern Shore, October, Southern Maryland, November 1st, Central Maryland, December 1st, and full implementation January 1st of 2021. I just wanted to be sure, because I gave an overview thinking everybody knows this. So I want to just go back and make sure everybody was clear of what region was going to come on what time of the month. Okay.
Thank you. So here's a question for, well, Patricia, let's have you answer it. What, if anything, does a participant have to do to sign up for EVV?
That's a great question. So the participant doesn't really sign up for EVV. Really, if a person is getting personal support services, then that is the service that would have to be in compliance with the EVV system. And what needs to happen is that the CCS will be working with that person and making sure they have the proper information, the device, and how it all works. So that's the main thing. You don't have to register for it, or you don't have to apply. There's no application for it, just being in that service. Joey, do you want to add anything to that?
Not much to add. I think I covered the bulk of it. I would say just the only expectation probably, or the main one, is to just work with the CCS. If they need a working phone number for you, that can be used for EVV. And that's a phone that you are able to let the DSP use to clock in and out. And to communicate with them if your phone is having issues, or if you think you need an OTP device based on some of the reasons that I mentioned earlier. And so talk to the CCS about that and coordinate with them to get that delivered and assigned to you.
So Joey, there are people who get services both through the DDA waiver and through the Community First Choice plan. And there's a question that says, we already have an OTP device because we've been getting services through CFC. Are we going to have two? And how should all of that work?
Good question. I'm glad you're familiar with them. So individuals who are receiving CFC services who also have an OTP device assigned for those providers, they should be able to use the same OTP device for both DDA and CFC services. And then the different providers for both programs should know how to clock in and out. They'll have slightly different procedures, but that's pretty much up to them to know and understand.
Okay, and then Joey, there's one more question about the device itself. And the question is, you had talked earlier about all of the different things that electronic visit verification verifies. And so the question is, how does it verify anything other than the time?
So the device itself does verify the time. So like I mentioned, it changes every 60 seconds, that code, and it's synchronized to a specific time of day. But the other important piece that it identifies is the individual receiving services. And so that OTP device, because it's assigned to a specific person, the system recognizes that assignment, and it then records that person as having received service for the associated clock in or clock out.
Thank you. So there are a couple of concerns here around, what if people lose their device, or, sort of somebody says, my son isn't really good at hanging on to things. Sort of, do you have any thoughts or ideas about that? And maybe Kathy, let's start with you, because I'll bet you're thinking about this as you roll it out.
Yeah, we've been thinking a lot about this. What we're going to be doing is we know that folks tend to lose things, especially those tiny little things. So we're working with each individual to try to identify a place to keep it, a wallet. Do they carry keys with them anyway? Can we attach them to their keys? The lanyards, a variety of things. Putting it in the same place every time you come in. So it's really going to vary from person to person as to where they keep it. And we know that things are going to happen, so we just have to kind of go with it and just work with each individual to try to figure out what the best process is for that person.
So Miriam, there's a question that is not specifically about electronic visit verification, but a couple of people want to know, how do you learn more about the life course, which you had talked about at the beginning, and are there trainings? How do people get connected with that?
Well, there are some different ways to do that. One, you can always reach out to me, obviously, but another, there are no specific trainings taking place currently in Maryland at this time. That said, if we can provide information and the link to the National Community Practice, the Charting the Life Course Nexus website, we can get that information out to folks. There you have access to all kinds of videos and trainings at different lengths and duration, and which are incredibly helpful. We do have the Maryland Community Practice statewide leadership team meets on a bi-monthly basis, and we have established about 5 local community practices, but due to COVID, those local COPs have not been particularly active. We are working to develop a web page on our National Community Practice. We'll be able to update information related to all of this. So what I would say currently, if you want more information, to please contact me, my email. Also to continue to check back on our website, DDA's website, to get further information related to it, and sign up for the newsletter to receive information through the newsletter as well.
Thank you. Joey, there's one more question about acronyms, and folks want to know, what does LCSS stand for? What are we referring to when we talk about that?
Yeah, that's a good question. Sorry, I think I maybe threw that around without explaining too much. But LTSS, or long-term services and supports, that's how it's typically used within these programs, but it's also the name of our tracking system for case management and for billing for individuals receiving a lot of these home and community-based services through DDA, as well as other programs such as CFC. And so the full name, LCSS Maryland, your CCSs will be using that, your providers will be using that to bill, and it's an important system for us to keep track of what services individuals should be receiving, and what services providers should be giving to them.
Thank you. Kathy, there's a couple of questions. It sounds like maybe some direct support professionals signed on as well today, which is great. We're happy to see lots of folks on today. And people are asking, is this the same thing as a timesheet? Do you also need a timesheet? How does that all work together?
So that's going to be very specific to the agency in for which you work. We are choosing not to use it as a timesheet, just based on the nature of our organization. But I would suggest that any organization continue to do whatever internal system that they have to document time and goal completion, to continue to do that. This is really just a system that kind of works in conjunction with your billing department to get your services paid for.
Okay, so here's a request to clarify. For EVV, do you use only one of the two, the phone, the participant's own phone, or any phone plus the OTP device? Is that right? Joey?
Yeah, I can speak to that. It's not required that only one is used. I think in the example I mentioned before, there are instances where maybe sometimes a landline or a cell phone that belongs to the individual is used, and sometimes an OTP device is used, depending on the circumstances of where that service is being delivered. Typically, people will use one or the other. And I would say that for people who have working phones that are available and don't really have problems except intermittently, they may not need an OTP device. But I think that need is something that should be discussed with the CCS, and families in the CCS should come to an understanding of what will work best based on their needs.
Right, thank you. We have just a few minutes left. So right before I turn it over to Marianne, Patricia, there's just a couple of questions around plans to share information about how this will all work in self-directed services. You want to just talk for a moment on that and then turn it over to Marianne to close us out? That would be great.
Sure. Thank you, Erin and Marianne. This is a really very informative webinar, and thank you for the opportunity. I think that there's a lot of questions about the self-direction in EVV, and we are working as soon as we get the approval from the Maryland Board of Public Works as to who the new FMS vendor is going to be. We are able to then discuss openly as to what the next steps are. It is my understanding one of the requirements that we have in the RFP is that once it is awarded, that FMS agency would be able to start implementing and working with our self-direction participants in implementing the EVV system. So they would come in with the EVV system, everything in place, and then we would need to do education and training for families so that we can be in compliance. So at this point, until we hear from the Board of Public Works and who is the awarded of the new FMS contract, then we'll be able to move forward. We do have a backup plan in the event that does not occur, but we are definitely going to be moving forward with people with self-direction in EVV. And once we do that, we're hoping to start having education meetings, dialogue with families, participants, very similar to what we're doing now with the families in personal supports and the traditional services. So please stay tuned, and we're hoping to communicate as soon as possible with all of you on the next steps for people in self-direction in EVV.
Great. Well, thank you, Patricia. In closing, I would like to thank Joey and Kathy for sharing your time and expertise with us. It's, as Patricia said, it's been incredibly informative. I'd like to thank Patricia and Erin for reading the questions, and I'd like to thank Deputy Secretary Bernie Simons for the opportunity to host this webinar. On behalf of the Maryland Community Practice for supporting families, thank you, all of you, for joining us, and I hope you'll join us for our next webinar on October 14th from noon to 2 for training on Expectations Matter, My Life, My Choice, My Plan. This training will provide a deeper understanding of the person-centered plan process with the opportunities to build skills utilizing an interactive platforms. We're really excited about it, and I hope you'll join us. Until then, thank you, have a great day, and be safe. Bye-bye.